his science college. And hopefully we could have a very fruitful webinar today. As you know, this webinar based on our program and arrangement to have international webinar with the famous scientists in the field of the things that we have in our university. This webinar is going to be held with the title of Enhancing Clinical Reasoning. Enhancing Clinical Reasoning Skills through interactive and gamified virtual case scenarios. It's very important. And as you know, clinical reasoning is the most important thing that the medical doctors and medical educators should know to teach and to learn. And then it is a very important thing now on this time as an issue in the field of medical education. And clinical reasoning will help all the doctors to deduct and decide correctly based on their thought and based on their clinical reasoning skills. So today we started our webinar with 13 minutes delay, and please have my apologize and my colleagues apologize for this inconvenience. And hopefully with the very fruitful webinar of Professor Dr. Hasnain Zafar, we are going to listen to his lecture here, and then hopefully all of us can use this webinar. Some of my friends came and go because of the misarrangement of the time. Now, on this time, we are going to start, and hopefully all colleagues and all the people who want to be here will, let's say, enter to the room and listen to the lecture of Dr. Zafar Baluch. And dear Dr. Zafar, do you have my voice?
Yes, can you hear me?
Assalamu alaikum.
Walaikum salam. Thank you for the opportunity.
Thank you very much. You are in Iran or you are in?
No, I'm in Malaysia.
Okay, because on Thursday we have we had a gamification seminar in Tehran University of Medical Sciences with the help of Dr. Bigdeli and the other colleagues, and I thought that you were there and have some, let's say, lecture there. But it's very nice of us and it is a good opportunity for the SMUMS and me and my colleagues to have you here again. And inshallah, we will use your very fruitful webinar as we had before. The floor is yours. So I'd like to, firstly, I'd like to thank Engineer Mr. Khalil Reza, our dear colleagues from EcoSF, and thanks again from Dr. Tayyebi, the president of EcoSF, to help us. And then this webinar is going to be held by the help of EcoSF, Eco Scientific Foundation, that help us to use from this, let's say, platform and broadcast or webinar via the region. This is an international webinar and that we have it with the help of EcoSF, Professor Dr. Tayyebi and dear colleagues of them, especially Engineer Mr. Khalil Reza and the other colleagues, and I don't know the name of them, but I'd like to have my appreciation and gratitude from them. And then dear, floor is yours. Continue with your fruitful lecture here, inshallah. Thank you.
Sure. Thank you. Thank you for this opportunity. And thanks for the participants to come and join. The topic I'm going to explore today, can you see my slides also?
Yes.
Okay, perfect. Actually, this is our university name is changed now. Last time was International Medical University. Now it's IMU University because we are diversifying, including One Health concept. So our logo also slightly changed. So this is our building where one of the campus, and we are even opening new campus soon within 2 months' time. Okay, so enhancing clinical
reasoning. They changed the territory, or they progressed and developed the territory of medical?
we have developed like veterinary and environmental health, plant health also. So we are incorporating One Health concept, and we even started a new school, two new schools, School of Business and IT, and School of Psychology also. So our target is to be top 500 universities, within couple of years. So
Very good, very
let's
good,
see.
very good, very good.
Okay.
Thank you
My
very
voice
much.
is clear? Everything okay?
Yes, yes. A
Okay.
bit, there is
So
a ambience, I think, in your voice, but if you check your mic near to
how about
your,
now? Is it better?
yes, yes, it's better. Yes.
Okay. So topic I'm going to explore today is enhancing clinical reasoning skills, and focus will be on how we could create virtual clinical cases or scenario-based learning, and how we could incorporate the gamification or gamifying our virtual medical cases. So feel free to put your questions in the chat, because I am always monitoring at the chat also. So this slide is developed by one of AI tool. Okay. So wherever I use AI tool, I will mention at the bottom. So when we are talking about enhancing clinical reasoning skills, not every time there is opportunity for students to go and observe and interact with real patients because of so many reasons, like patients may not prefer, or sometime, the hospital authorities don't allow, because of the seriousness of the cases. So how we could address this situation by incorporating virtual clinical cases based on real scenarios. And during COVID time, we have experimented successfully, our clinical campus. Our students were not allowed to clerk patients, not even visit a hospital, So let's move on. This will be the overview of my webinar, where I will introduce basic concept of scenario-based learning, then how we could improve clinical reasoning skills and what is the importance of clinical reasoning skills. Then I will touch a bit on virtual clinical scenarios or cases, incorporate gamification, and later part of my webinar or talk, I will be sharing with you some of the tools. I have tested, I think one of the tool is accessible in Iran and freely utilized, or you can use any learning management system and incorporate this scenario-based learning and let learning management system do the rest. And if you want technical assistance, contact me. I can actually even assist you technically. And later on at the end, we will have a Q&A session. Okay. Now, if you're looking at this diagram, can anyone type or explain what is this going on? This is way back, how we taught our students in the past. And on the first floor, you can see in the gallery, all students are actually looking at, there is maybe operation going on or some experiment, some process is going on at the ground floor. And that's how they observe. But now we are going to change this scenario into a virtual clinical scenario-based learning. Okay. So the importance of clinical reasoning in healthcare, it actually diagnose accurate, and I will be sharing one of the research we did, think aloud approach, and few other approaches we use where we let the learner don't go directly to the diagnostic. Even learner or even doctors or clinicians, they are sure 100% that this is the symptoms and this could be the diagnostic, but still you have to discuss, you have to even ask yourself what other possibilities could be. So when you are doing this clinical reasoning, I will share in later slides, and how we could minus or deduct, all possible reasoning or all possible diagnosis, and reach to the most appropriate for a particular patient. And it could lead to personalized care, because every patient or every person having a slightly different chemistry, Even this morning, I was having a lecture on digital health, masters of digital health, and we talk about genome, and how we could do the genome sequencing for population of a patient and do a precise medication, or medicine. So when we do this clinical reasoning, it will help us to make the decision making more efficient, and it will overall improve the quality of healthcare. So these are the few important elements why we need to do clinical reasoning in healthcare. Now, virtual cases, I already explained to you. It helps us to give more active or interactive narratives or scenarios, and learners will have option to go back and do multiple times, and we can mimic, we can copy actual scenarios and convert them into a virtual environment. So that makes, even you can increase the complexity. You can even copy the sound of actual hospital and embed into this virtual scenario. So that will make our learner to feel more better when they will be placed in a hospital. We can give adaptive feedback because we have a platform. We can actually, these tools will allow us to give learner the adaptive or detailed feedback, and we can incorporate gamification element by putting some timers, some points, and even sharing the leaderboard. Whoever score better, you can actually show them at different ranks. So that will motivate learner to perform better, to reattempt, and to learn more. Now, designing immersive case scenarios with branching narratives. So you have to sit down. This is one of my experience when we ask our clinicians. They may have 30 years, 40 years, even sometime 10 years experience in running clinics or doing the same procedure. But when we ask them, please write down in a storyboard form, they will miss a lot of things because they are very good when they enter into operation theater, when they enter into clinic. That's part of their DNA. They will follow each and every step when they are physically in OT or in a clinic or in front of patients. But we want that information or that knowledge put down on a piece of paper and convert that into interactive scenarios. So you need to have a comprehensive clinical case background. Okay, so you can ask even physicians to give you detailed patient histories, what questions they ask and what was their answer. Everything need to be jotted down and incorporate in these virtual scenarios, even presenting symptoms, contextual information, and that would set the stage for our scenarios. Then you come up with the branching decision points. So you have to ask clinicians what make you decide the next step. Okay, so sometime they will be hard to give you reason because their practice, their belief. So, but we need to extract this information so that it should be incorporated in our virtual case scenario, so that when learner will practice, they learn. They also find the reasoning aspect of their choices, and then at the bottom, you have actually dynamic patient responses. So you need to incorporate whatever or how patient reacted, So that will create a realistic virtual clinical case scenario. So hope clear everything, right? If you have any question, just type in the chat. If everything is okay, just type 5, okay? Let's see how many of you are here. Everything okay? Type 5. Okay, thanks. How about others? Okay, great, great. Okay, perfect. So let's move on. And when we are talking about clinical virtual scenarios, so we are promoting active learning or even critical thinking, like because you are giving them immersive learning experience, because sometime in real case, if you bring group of students to your clinic, the environment is bit stressful, because you will have some limitations. Students may not interact directly with the patient because clinician is taking care of that patient. And as you recall the picture I showed you, students were on first floor or in the lobby, in the balcony or something like that. They are not able to interact with the patient. They just need to be observer only. But in this case, you are giving them option. They can interact. They can make decision whether right or wrong. That's the whole idea of this virtual scenario. And it will allow students to come up with hypotheses and then refine their clinical reasoning skills through decision making. And I will show you one of the sample case where we always incorporate assessment. Even in patient history taking stage, we ask questions. We ask learner to pick what would be the next question if you are a clinician, and let them make mistakes. And then later on, we can give them feedback, and that's how they learn more. Then problem solving skills can be enhanced by practicing, by let them do again and again, repeatedly, and giving them constructive feedback, and that would enhance their clinical reasoning skills. Okay. Now, integrating virtual case scenarios into curriculum, and we have noticed most of medical education curriculums, they have incorporated this because of ease of getting. But only challenging part is if you go buy off-the-shelf product, you may have 200 cases, different types of cases, different level of difficulties, but very hard to contextualize to your local needs and requirements. So that's why we have evaluated a lot of platforms. They are a bit expensive, but ready-made cases are there, but they don't allow you to modify. They even don't allow you to modify the names of patient or scenarios a bit. Certain diseases may not be incorporated, which are always in your local trend. Like in Malaysia and Indonesia, we have dengue fever. But when we check in all these cases, dengue case was not there, or few others, cases. So that's one of the challenges. So you can even incorporate different clinical practices, and you can have a continuous assessment. So this is a few importance of integrating virtual case scenarios or virtual clinical scenarios into your curriculum. Evaluating the impact of student engagement, we notice and we track also, there are a lot of students, when we ask them to learn on their own, we found that they were very much engaged into. They increased the engagement of students, because so many reasons, like there's no pressure, it's like a formative assessment. They just do the task, complete the case. At the end, they will get feedback. If they are not accurate, they can redo again. Improve clinical reasoning because we allow them to make maximum mistakes, and later on they could self-evaluate themselves or reassess, and positive learning outcome, because virtual case scenarios have been shown to improve overall academic performance and knowledge retention, because when they practice the cases and it so happened that some similar case they have to clerk in the actual scenario in the clinics or hospitals, so they will improve their retention of knowledge, right? Now, anyone can recall or can know any logo here on this screen? Let's see. If you scan this QR code, you will get some free gift, but gift will be in electronic form. Okay. Maybe you will get access to all my slides, Yes, anyone, any logo you can access on this screen, or any term you are familiar with? Just type in the chat.
We have to find the logo.
No, if anything you remember or you have used it, then you can actually tell me what is that, which logo, or even any term,
No.
For sure, you have heard of augmented reality, right?
Yes.
Yes. Yeah, Kahoot. Yeah, very good. Kahoot is a
Yeah.
very good platform where you can use to engage audiences, gamified also. Yes, very good. So similar concept we can incorporate into our virtual clinical scenario also. Um, uh, okay, prognosis is another free application I will be sharing later on. I was inspired by using Prognosis and few other platforms, and then we decided that at IMU University that we should develop our own. And COVID have expedited this project because when 2020 we were having less than 20 clinical cases. Now, at current stage, we have around 100 cases. And all these cases we have developed with our own clinicians. So they have shared, I will show you the whole process, how we could incorporate. Okay. Thanks, Dr. Hadi, for sharing this Kahoot. Okay. Now, anyone recall this image? Yes. If you look at the URL, you will know. And I don't know whether you're allowed. Yeah, Angry Birds. And how many of you have really played this? It's a simple game. If you notice, all these birds, you need to select, drag, and drop. I don't know, in Urdu, we call gulel. It's actually a wooden stick with the V, and we have a rubber, and we put stone in, and we stretch and throw it. So same concept they use for Angry Birds. And I have spent like hours playing this game. Same thing. Every stage, you have to destroy some structure, you stretch, and you play. Slingshot, yes. Yeah, you're right. Absolutely right. So that's the concept. So you drag, drop, finish the level, and move on. And the way it make the challenge very simple and interesting and engaging that you will end up playing for hours. And then you will find different strategies. And then you will realize that each and every bird have different impact when they hit the structure. So sometimes if structure is big, you need, a bit bigger bird to hit and approach also. So while playing this simple game, you learn a lot of things, structure of the buildings, the projectile angle, and so many other things, right? And just to let you know, by 2025, by next year, you will have this gamification market around $30 billion. So just imagine how you could actually leverage on this element. But just be careful due to our healthcare and medical education area, we have to incorporate serious games element, not for fun, because we don't want to transfer this characteristic in our students that, oh, carelessness, or it's just a game. No, because of our responsibility of treating humanity or mankind or humans or patients, we have to incorporate serious games element whenever you are designing, and I will be sharing those elements later on. Okay, so this is where I always bring back zone of proximal development, way called Koski activity theory, and where he explained this zone of proximal development. Like we need to know what are the things which learner can do on their own. They don't need our help. So let them do on their own way. Okay. And then you need to identify what are the things which they need our help. So we need to mark that, and then we provide assistance accordingly, And then the key point here, we have to make sure you notice this in the middle, the zone of proximal development. You have to balance this. You don't need to make the challenge so high or so difficult that they get frustrated or they will give up. And you don't need to make the challenge so easy that they will say, oh, it's boring, you know. So we need to adjust all this while designing your scenario-based learning, okay? Or incorporating this gamification element. Any questions so far? Everything okay? Now I'm moving to scenario-based learning. So what is scenario-based learning? Where we need to incorporate maximum wrong paths to reach to the conclusion or treatment. Okay. So when we are talking about scenario, mostly is non-linear. It's not step by step and following the same steps. It may be out of sequence. Based on your decision or based on your choice, you may have a different path, but leading to same destination. And it need to be contextualized. You need to link it to either your curriculum, either your, maybe your regional diseases. You need to incorporate that. So that will make it, more realistic, right? And then a role specific scenario. You need to come up with the scenario for whom? For clinician, for our nursing staff, for pharmacists, for specialists, for patient, sometimes role simulated patients, you can let this scenario, they can use and learn or train. So you need to be very specific for whom you are designing this scenario. Okay. So role specific scenario. The most important element in any scenario or any talk is the story. So you need to come up with very strong structured story. So if story is there, your learner will engage from start till end. So hope is clear. These are the main. There are so many other elements, but I just picked these four, which will make or decide whether your scenario-based designing is successful or not, or able to engage learner or not. Okay. Now, scenario-based learning key elements, you need to have a challenge. Okay. Challenge could be, you call normally in assessment the vignette, right? Where you come up with like a male patient, 40 years old, this is his symptoms. So that could be a challenge, and you want to learner to do what? And then provide choices based on that challenge. You will give them choices. Once learner pick these choices, each and every choice will have a different consequences, and they will move on. If I pick first choice, I may have a different scene and I may have a different consequences, and I need to handle this situation and then move on. Again, you repeat and you will get feedback. You need to have a proper story behind it. When we are talking about balanced scenario, I will show you in next slide what we mean by balanced scenario. So if you recall zone of proximal development, you need to balance that level also. Okay. This is how it goes or it designed, and you can copy this. You have a challenge, you have choices. Every choice you will lead to different consequences or different scene. So this is a simple scenario. Okay. And here we have more series of branched scenario where you repeat the same thing. You give challenge, you will give choices for learner to pick. Every choice, different consequences, and then you can add on more challenge. After you reach to that consequence or that scene, you add another challenge, then give them choice. So what you are doing, you are branching the clinical scenario, or I would even say chunking the content and engaging learner effectively. And at the end, you can actually loop back and give them feedback. Any question on these two slides? Everything okay?
I have a question from the
Yes,
previous slide,
please.
I think. With the diagram I saw, but I tried to say something, my system doesn't let me. If is it possible, if we can go back to slide, I think.
Which
Excuse me.
one?
No, the last one, the previous, yeah, this one.
Ah, yeah.
Uh, I want to ask you, is it possible? Would you please explain more zone of proximal development? Boarding. Okay, I think it is a bit like the other slide that I thought as a flow state, zone of proximal development. Okay. Would you please
Yeah.
a bit
Okay.
about that? Thank you.
Yes. I will give you example. When you go back and when our children were young and we were giving them, teaching them how to bicycle, how to learn how to cycle. So there
Mhm.
was a stage. First of all, you will not give them a bigger cycle, okay? So you
Mhm.
have to give them cycle according to their height and their
Yes.
age. So you are leveling the challenge. And
Mhm.
then when we are talking about zone of proximal development, you need to make sure if the challenge is not that challenging or the level is not that challenging, they will not learn anything. It is, they know already. So you need to incorporate scaffolding element also. So if you notice while you are teaching your children how to cycle, you will always be holding the seat of the cycle and running next to the cycle. But
Yeah.
when you observe that they can now pedal, they can focus on the handle, they can balance the cycle, without telling them, you will remove your hand and let them go on their own.
Yes.
And I think most of you will experience this. The moment the child know that my father or my mother is not next to me, they will fall down.
Mhm.
This is what happens. So what I'm trying to highlight here, same in learning process, you can actually dive and search in more activity theory. So that will even explain more in detail. We have subject, we have objective to achieve, we have artifacts, mediating artifacts or factors. So how we can make sure that how these factors will influence learners and we achieve the objective.
Thank
So
you.
in hope is clear now, right?
Yes, yes, thank you. Very good. Anxiety
No
and
worries. I
very
think I
thank
have a paper written on this. If you Google my name and activity theory, you will get the paper. It's open access. Okay.
very
Where
good.
I explain about designing learning activities using activity theory and zone of proximal development.
Thank
So
you.
that makes a very interesting study.
Yes, very good.
Okay.
Yes, thank
Yeah,
you.
please.
Thank you.
Please, you are saying something. Go ahead, Dr.
Thank
Almaty.
you. I've
No
seen
worries.
this as if it is a flow. Let's say we say in teaching the people and the employees flow state. It's like
Uh-huh.
something like that. The Mihai Csikszentmihalyi model tell
Uh-huh.
us many things about that, and it is a very good diagram that it is a bit, let's say, like that, and it's very good anxiety and burden when you say something that is higher than the level of, let's say, competence makes anxiety, lower than the level of competence makes burden for the person.
Yes.
It's
Yeah.
very good diagram that tell us many things, and thank you very much for your very
No
short and
worries.
very
Thanks for
fruitful
asking the question and
Thank you.
no worries. No worries. Okay. So we were on this, right? So we have
Yes, yes.
different scenarios. You can actually copy paste and up to you. What we did for semester one scenario should be simple. Same patient, same scenario, but difficulty level will be not that high. You add on complexity to the same scenario as they grow. So SAM 10 may have a lot of things to cover in the same case. And please work with, we call IPL concept, interprofessional learning or interprofessional practice, IPP, where please include from different departments, your faculty colleagues, ask them to sit with you in designing the scenarios. Okay, that would be a very nice scenario. Okay, this is another example, and you can use storyline for flow channel. Okay, that's what Dr. Ahmadi was highlighting, like flow channel and all that. So you have a link down there. You can search like how to engage learners with scenario-based learning. And this is from one of the article on for instructional designers, how we can engage that. Okay. Now, leveraging adopted feedback, and if you, when Dr. Hamdi, you were asking this question, in my mind was adaptive assessment. So that is something similar also. We gave them question, and if they answer correctly, we raise level. We increase gradually. The whole idea is to challenge them and get to the destination. Yeah. So there are a lot of salams. Okay, walaikum salam. Yeah. So I don't know what they are talking in English, Persian, but hopefully everything is okay. Yeah. So you can give real-time feedback when they are doing these real virtual scenarios, or you can always track performance. I can share with you, I think most of your university is also using Moodle as a learning management system. So this tool will work very well with Moodle. And you could track, if you can publish as a SCOM, that would be great. And you can track even so detailed that every slide, how much time they spend, every scene or every assessment, what was their response. And you could work to improve and give them feedback, and it will help for sure adaptive learning and what I was telling you about adaptive assessment also. Okay. Now you need to come up with the storyboard, and this is, I'm sharing a simple format of your storyboard. So you can copy this, you can use this in Word or PowerPoint or any other storyboard tool and start writing. So for example, your situation or scenario could be a male patient, 40 years old, come into dentist clinic with severe pain. And you can make it more interesting in adding more details. So challenge number one, how to tackle pain. So what is the first thing you as a dentist should do? Then you give them choices. I pick today dentist, dentistry, but you can pick all of your units or specialties and come up with consequences. Then give the challenge to, and based on real case, that would be even more nice case for learner to learn. Okay. So any question on this storyboard? All okay? Just type yes. Okay, okay, thanks. Now I'm moving on and I'm sharing with you, this is a screenshot of our virtual medical clinic case where we have a head injury, and I will show you, these are the screenshot. The first one on the left is actually the first screen where learner have to read this. I will show you, I think better I demonstrate now. Okay. Can you please confirm you are seeing my screen now? Yes, no? What you're seeing? You're seeing head injury? Yes, no? Okay, we can see head injury. Perfect. Okay, so let me show you the case. Okay, yeah, good. So this is your scenario first screen. And everything I want you to read very quickly. And then I will ask you to take up this as a practitioner. Okay. So a football player is brought to emergency room with history of injury to head while playing. 2 hours ago, while playing, accidentally he sustained injury. You can add more. So appointment type is emergency. Once you're done, you can click start. So now we sat down with one of the emergency surgeon, and he gave this clean scenario, and we converted into this, and he gave us permission to share with audience because he's using this case to even train junior or emergency paramedical staff, because sometimes very hard to get a case and the people who wants to learn also at the same time at the same venue. So now this is a history taking. Please read through and then I will move. We categorize, we chunk, we break down into, you see, different types because we notice it's a long types of questions, different types. So we group them like unconscious. Did you lose consciousness? Yes, I had sudden loss consciousness. And how long? So no, I wasn't aware, but my colleagues have mentioned that unconscious for about 30 seconds. When I regained my consciousness, I saw my team players and referee surrounding me. Okay, because it was a football ground, there. And then fits. Did you experience any fits, meaning any abnormal uncontrolled movement associated by tongue biting, unaware urination, or drooling? So this is how none. So we move on. So please read the case because later on there will be assessment after this. Okay. Yes, I have vomited once after the injury. Okay. Now these are other history taking, and you can realize this may not be that important to the assessment. That's why I put it in group form like this. Once you're done, we proceed. May I ask your colleague some questions? Yes, because you need to get comprehensive patient history. So we asked the family member because he was playing. So the person who brought him in, we are going to ask him, right? Yes, doctor, I brought him here and I'm one of his team player for this football. Okay, sorry. Then there will be a few more questions. I skip now. Yes, I need you to answer this. Yes, what would be your choice? First one or second one? You just type number 1 or 2 in the chat and I will select for you. What is lucid interval? So those who are medical doctors, they are very familiar with these terms. Yes, what will be your option? First one or second one? Just type in the chat. 1 for first, number 2 for second. Okay, let's pick. I will wait one more. Okay. Oh, we need to have consensus. I can only pick one. Okay. We need one more. Let's vote. Which one? Dr. Ahmedi, help us. You will go for? You're muted. Okay, just type in the chat. Anyone? Okay, 2. So let's put I follow the majority. Okay. Let's move on. Now, how do you explain the unconsciousness in lucid interval? Yes. Which one now for this question? Please type in the chat and I will follow that. Okay. No, don't worry. Nothing will happen to patient. Okay, 2. Let's select second. Now we have asked them to interact, ask learner to interact further by putting some kind of hotspot here. And if you notice here, once they click, more information about the patient. Okay, so you see here, temperature is 37. You look at the eye, there's no visual symptoms. You look at the mouth or air breathing and so many other things. And then you check here. So this is the vital signs. PP is here. I want you to pay attention on these numbers because later on there will be question. Okay, so let's proceed. Same here we have. Okay, then we try to make it real, close to real, and we ask, oh doctor, my head, it hurts, please don't worry, Mr. Kumar, you can change name, and right away I am starting the treatment, and that will be elevated, your headache. So proceed. Now, while planning for investigation, Mr. Kumar, headache increase, select the best action to take. Yes, back to our experts. Which option you want? First, second, third, fourth? Let's see. whichever second one. Okay, shift to for urgent CT scan. Okay, good. So there will be the headache and episode of generalizing. Okay, so this is CT scan report is awaited, following which his BP noted to be rising, blood pressure goes up. There was, left ripple increase for 2.5 mm. So more information is coming in, and GCS dropped to E1 V2 M1. Okay, all these technical terms, right? Let's move on. What is the cause for the rising BP and how will you manage? Yes. Any expert here? Which one you will select? First or second? Second. Okay, good. Thanks for submitting. Yes. How about this one? Why is there bradycardia? Yes. Anyone? What would be why? Why this is the situation? First one or second? Okay, first one. Let's move on. What medication will you administer to prevent further episodes of seizure? Okay, first one. Wow. So now you are already trained. I no need to ask. Good. Okay. So let's move on. How will you grade the severity of head injury based on this CSC? You will go for first option or second? First or second? So let's make it first. Submit. How do you correlate GCS with airway management? Any option? Preferred option from experts? Okay, second, I will submit. What does the pupillary asymmetry indicates? First or second? Okay, Dr. Taiba said second. Okay, let's submit second. Now you see the CT scan comes in. And this is a real CT scan, okay? Actual CT scan of the patient, because that's the benefit of engaging clinicians. They have resources to be shared. Now, let's drop this one, left temporal horn in where you want me to put here. Okay. How about this one? I may be going wrong, but no, don't worry. I will just put this, but how we have engaged, and I will share with you one story. I'm just, without reading, I'm just placing. And you notice we are not giving feedback. There are certain cases where we can give immediate feedback, but we don't want to disturb the flow of treatment. Let let student, go and do all these assessments. I think the first one, right? Oh, someone says second. Normal study? Is this normal study? Second. Okay, let's try. Then move on. What is the next line of management? So patient needs symptomatic treatment. Okay, so you can pick maybe few. And now this is actual wound, actual image. Okay, so again, you need to identify. I may be wrong, but I'm just doing it because of the time. And this is actual after the operation happened. This is how it happens, and we are sharing this. Submitted. Now, what is the importance of having the operative wound drain? First one or second one? Okay, first one.
Oh,
Okay, good. Let's move on. Oh, good. Thank you. Because I got only 2 stars. Normally, the best one would get 3 stars. Okay. And you can review. Once you review, they will give you the correct answers for all the assessment. Okay.
mm.
See? So you can go in, you can do multiple time, reveal the correct answers. You see it replace. That's how you learn. Click
There is
next,
a
reveal.
question, Doctor. Which software do
Yes,
you use for this content
I'm
production?
coming. I'm coming.
Yeah,
I'm coming in the tool section. I will share. Don't worry. Okay.
thank you.
Then you go in, reveal correct answer. Not bad. If I do alone, I get 1 star.
The patient will
But
not die, inshallah.
yeah, yeah. And sometime, we make that. You see, thank you, doctor. But if I got 1 star, the patient will be angry and saying, I'm going to go to different doctor.
Yeah.
That's how you could. And you can
Thank
retry
you.
many
Very good.
times.
Very good.
Okay. So this is our first version of one of the case, where we have, you see, history, examination, management, and finish. So you can come up with the storyboard, and for storyboard, you can use PowerPoint or Word. And I shared the template only. You can add in more complexity into that. Now, uh, with the help of this virtual clinical scenarios or cases, you are incorporating telemedicine skills into our students, because in telemedicine, you need to interact via computer, so you are actually training them that skill also, and remote clinical experience also. So this is what one of the benefit we can get. Now, I'm sharing this during lockdown. Professor Shahid Hassan and myself, we did this study. He was he was a surgeon, ENT surgeon. Okay, so during COVID time, his students could not go and clerk patient or go and visit patient in the hospital. So he discussed with me. I said, let's convert bedside teaching to beside teaching. Okay, beside mean always there, or online teaching. So we have used Gibbs reflective practice. We have used think aloud approach, hypothetico deductive approach, which will actually improve the clinical reasoning. And each and every stage, we come up with the real scenario. And luckily, Professor Shahid Hassan was having a video of all these processes, real videos, and he took consent from the patient to be shared for learning purposes. So we can incorporate all these videos and materials. Like just now, the case I shared was image only, right? But you can do videos also incorporated. You can even do a management debriefing at the end. I showed you how you can get the feedback and all that. To access the paper, you can scan this QR code, or you just search beside teaching. You can put my name also. You will actually get, this is an open access article. We have actually got very good feedback from this article. They invited us to conduct workshop on this concept. Okay, augmented reality or virtual reality, you can incorporate that also. And I think 2 years ago, if I'm not mistaken, I came ICHP in Tehran University of Medical Science, the conference. I will show you a video which I have captured. I think you have tool and technology and companies already available which can do that virtual reality simulated based training. So you will notice some of your students here. So this is a local company, and I'm not promoting this company. I just actually no commission from this company. Okay, disclaimer. I'm just sharing for learning purpose. You see, so she's doing CPR, and you see it was in a Persian language, and then they translated. I mean, they changed the language. So due to time, I will skip, and you see, yeah, and everything and all you can actually get all what she's seeing in the VR case, VR goggle. That is what's shown on the monitor also. Okay, so let's move on. Okay, so she revived that patient. Okay. Okay, live, well done. So you see the green bar, it's mean the patient is live back. Okay. Now, the question you asked, Dr. Hamidi, about tools and platforms. So you can use, there are many tools, but I will be sharing with you the free tools. Okay. Uh, Let me share with you the tools. Okay, for storyboarding and for scenario creation, I will share this Whimsical. Okay, for free version, you can create 100 scenarios. Okay,
100
but
scenarios, very good.
yes, 100 scenarios. And the cool thing in this tool, you can share with your colleagues and they can collaborate together. Okay.
Mhm.
So you can scan this QR code and hopefully it's accessible there. If not, then just use normal Google documents, okay, and share with all your team members and let them write or edit whatever they want, okay? I don't know, I saw something due to the logo. I think it is for International Medical University of Malaysia.
Mm.
Yeah, because all these cases, but these tools are free. You can download
Free.
and use, okay? Another tool which I have tested last time when I visited Iran, H5P. Yes, you go there and search branching scenario, and they will give you some template. The first template you are not allowed to reuse, but second template, history of Europe, you can download that and then upload. And this is how the branching will show you. You see, you start with art of history of art in Iran, then you go down different. You can branch yourself and you can edit.
Mm.
So if you really want about this, then we can have a separate workshop. I can actually show you how you can attach videos, images, questions. So you see on the left side, you can have video images, and then you can even add assessment also. Okay. Now I'm moving into gamification. Okay. So these are different badges. So as you perform better, you can give them badge, and you can redesign these badges also according to your own context. And if you're using Moodle, you need to install level up or levels up plugin, and by installing that you can incorporate this gamification element to your course. Or if you are using H5P, this one, you need to make sure you publish it in a SCOM or H5P content and upload to your Moodle. And then you will have all gamification element in. And if you want to make it more complex scenarios, then you need to purchase a software. We use Storyline, Articulate Storyline. There you can even put a timer. So each case, on average, will take 5 minutes. You can give them 7 to 8 minutes. So within 8 minutes, they need to close the case. So this additional challenge or pressure you are giving learner. Okay. Now, this is also a free tool, a free app, and I like it because it's developed by Sri Lankan doctors, and it's more like comic, cartoonish, but it's very powerful. So if you go search prognosis for Google Android devices, you can install. And there are hundreds of cases. Every case may not take more than 3 minutes. Prognosis. I'm just searching. Yeah. So let me show you. Oops, because of background. Prognosis, you can actually download. See this on the phone. And every case you can click and download, and then play. And they are keep on adding cases. So hopefully it's accessible, this app, and you can practice. I think this is not only for students, even clinicians or practice physicians practicing when they are waiting, they can actually go through it to fresh up their knowledge, and very powerful. And this is how it goes in. Once you goes in, there are different specialties. So, and they keep on adding more cases. Okay, prognosis. And this is how you go in, you click one of the surgical case, and then it goes into this. So your progress, it shows the dashboard. So you can practice, you can finish all cases, wait for a few weeks, they will add more cases. Okay, so prognosis is one of the platform you can use. Okay, I have tried this last time, it was free. All COVID related cases were free. Okay, so you can try now. If you can access, that would be good. You can share with your students and ask them to go. So you see here, something similar like just now, the case I shared, clinical Odyssey, which you can actually touch. Okay. Evaluation of, adenopathy. Then this is the scenario. See, treatment advice. Then scenario again. So this is how you can do the diagonal, and then give you the stars once you will complete the. Okay, so there are different cases which you need to do and the score. Okay, BMJ practice. I'm not sure whether you have access or not. You can try. Google Play is blocked in Iran. What is another way to get softwares? Okay. If that's the case, then I would suggest you to build your own cases and convert that into app, APK, or even no need to convert into app. You can, like just now I was sharing with you web-based. You use H5P, upload to your learning management system and access using your mobile devices. So it would be website, responsive website, okay? So this is another case where you can actually click on different categories. Okay, what National University of Singapore did in creating this virtual clinical cases, they have incorporated AI. So I'm not sure whether you have access to AI platforms or not, but if you're interested in, let me know, then we can do another workshop on how to create AI assistant chatbot, incorporate inside your virtual clinical case. So then students can interact with the AI chatbot and all the knowledge base you can give from your clinician. Okay. Now, I'm almost ending the session, and this was the summary, like what we have covered. I introduced to you about scenario-based gamification, and then I highlighted the clinical reasoning skills and importance of it. And I touch a bit on virtual clinical scenarios. I shared with you one of the clinical scenario case in detail, incorporate gamification, serious games element, okay? Where we have points, we have stars, we have badges, and we have even marks or even time, within less time who have completed that. And then I shared some of the tools. Yes, some of the tools are not available in your country, so I do agree with that, but there's always workaround. So use H5P tool, build your own scenarios. It will take time, but it will be more authentic. So don't rely on off-the-shelf tools or platforms. Yes. Now, any questions or answer, please feel free to ask. If you want to know more, this is my blog post, slide share. This should be X, no more Twitter now. This is my YouTube channel if you are interested in. Do you think the fact that learner is not interacting with real patient in an authentic
Thank you very
situation will
much.
impact? Yeah. So
Thank
there's
you.
a, no worries. Yeah, there was a question talking about,
Yes, please.
uh,
Let me see.
yeah, yeah. Yes. Do you think the fact that learner is not interacting with real patients in an authentic situation will impact her interpretations and reasoning? Will the AI patient be taken seriously? Okay, I ask you back this question, but slightly different. What if they never practice in this virtual case and they go and interact with patient? How their reaction will be? I totally agree with you. It won't replace the real experience, but it will equip with them some skills which will be helpful. There's no replacement for real interaction. About second part, will the AI patient be taken seriously? Okay. Um, Let me tell you, 20 years ago, I learned about expert system, neural networks, and I was introduced to AI. Now, just 2 years ago, people have access to AI. So nothing wrong with AI, nothing wrong with tool. It's all depend on how you are going to use them. So AI will only guide or answer based on the data set or knowledge base. So if your knowledge base is given by a senior clinician, I have experimented, students really enjoyed, and it is actual responses of your senior clinician. If he or she can give you that question and answer in a text file, you feed into AI chatbot. The AI chatbot will not ask or search on the internet. It will only go into that document which is provided by or vetted by experts. So they will take AI patients seriously if you have fed in some, important and serious data to them. Yes. Any other question? Link of authentic app. All apps I shared are authentic. I don't know why you're. Let me share again. Okay. Okay. Let me share the apps. Okay. So the free one, I would say go to, yeah, even this one you can access. I'm not sure. Yes, this is authentic. I know even the people who are working behind this because they are Sri Lankan doctors. Okay. So I have even asked my own senior professors, clinicians, to please go through this case. Any misinformation? They said no. So it's actually authentic. If you find any unauthentic or not real or there's some not information correct, contact the person and they will fix it. Okay. Yes. So I was sharing with you H5P. Yes, I've been using for more than 3 years this platform, free, and it works very well with Moodle. So this Vimisical I have started using just 1 month ago. Okay, so far okay. Yes, any other questions? All other tools, some of these tools may be only paid, free version is for COVID related cases. If you want to access other cases, you need to pay. Due to significance of feedback in any learning situation, how can a virtual learning situation
Maybe there is some
foster?
limitation from Iran to have access to that
Yeah,
platform.
yeah. So there is a question from Dr. Hadi. Effectiveness of clinical feedback with the treatment be assessed by AI or the expert. Okay, just to let you know, there is no assessment part done by AI. AI will act as a chat bot. So you ask AI questions about that particular case, the case I shared, for example, this case. Okay, so AI will come in, only answer the text given by the clinician. We are not asking AI to go search on the internet. So it makes this case more interactive and it gives you nice feedback. You try it because I have used a lot of AI chatbot, but that was not the topic of this talk. Otherwise, I can actually share some of the platform maybe in next session. Dr. Ahmedi, you can arrange and I can share with you. And in less than 5 minutes, you can create a chatbot. And whatever you will feed in, they will answer. They will not go on internet and search. So I repeat again, AI is a tool. Whatever you will feed in, they will use that and give you output. If you give them not clean data, not serious or authentic data, they will produce not authentic or not serious, output. So hope I answer your question. We are not asking AI to assess. We are asking AI to assist like 24 by 7. I cannot perform always well, but AI can. If I give, let me search if you can access something. Then Function F. Yes. Please feel free to ask questions. Meanwhile, you know, I will share something with you. Yes. Any other question? Do you have
There's a
experience about
question
using?
about using pantomime, Dr. Zafar.
I don't know what is this for clinical learning process. Is it a
Pantomime
platform?
means moving by hands and facial expression to say something without words. It is a kind of
Okay.
gamification. I think that we had it in Tehran University seminar on
Right,
Thursday.
right.
I
Okay,
think that.
okay. Now I got it. What from where you're coming, and we use HoloLens and virtual reality, and with the gesture we don't
Mm,
talk. With the gesture it picks,
yeah.
and so we use that. And the issue with that, after 10 to 15 minutes in that environment, people feel not comfortable. So we have to design in such a way, not always you are working with gesture because you get tired. You are not trained to use sign language. We are trained to talk, and education or lecturer or professor love to talk.
Yes.
So yeah, but for something, yes, it will increase. It will increase the engagement of learner. Yes, we use that. Even Hollow Human, we use that in that case. And we even use immersive learning space where we use projectors, interactive short throw projectors.
Mm,
On the wall, there will be something you have to click or you have to drag. So that will increase the interactivity, level. And yeah, we can use that, right? Yes. Any other question?
there's no
Okay, so
message
let
so far.
me, yeah, oops. I'm sharing my own chat bot,
Very good.
and it will take less than 5 minutes to create, but I will show you in another workshop. This is a link. Dr. Ahmadi, can you check
Yes,
whether it's
yes.
accessible?
The link
Is it
of what? POE?
Yeah, this is my chat bot. You can click on it and you can ask. Let me share my
Uh-huh.
screen. Let me share my screen and I show you how it looks like.
Yes.
Okay.
I opened it.
You can access. Okay, that's great. Now,
Mm.
you see, you can write this. I put good day to you. I am AI bot for Hasnain Zafar. Feel free to ask any question. Yeah, so you can ask anything. What?
It works based on your data, based on your
Yes, yes, yes. Let me show you
that you have
my.
put in the system, and then it
Yeah,
answer
yeah,
us.
yeah. Yes, let me show you the things I uploaded. My resume, my research work, activities, things like that I uploaded.
Yeah.
So based on these documents, you can try. It will give you the reference also. Okay, list
And it answer
down.
us our
Yeah, yeah.
question based on your data that
Yes.
you have put there. Yeah.
And it gives you reference also from which document it's reading that. And you ask same question 4 times, it will give you
Mhm.
very nice answer. If you ask a professor 2 times, same question, he will get angry or she will get angry. She will say, I just now explained to you, you are asking me again, what kind of person you are. So actually, I would prefer the human, this bot can play better role. Okay.
Very good.
Yes. Okay. So if there is no question, then I will end my session. So
Do we have any access to your slides,
yeah,
especially?
on
Uh,
SlideShare, I will upload that.
very
And
good.
on my YouTube, I have actually covered this topic intensively 3, 4 times before.
Very good.
So if you can access my YouTube channel, and
Mhm.
I keep on changing slides. If you ask me, I have added more than 10 slides this just before. And due to I got half an hour, I added even few more slides. So
Thank you very much.
no
Yes.
worries. No worries.
We
Yeah.
will try, inshallah, in next webinar give you more time to have more slides and more
Sure,
put
sure. No worries. No worries.
science information.
And yeah, so all these platforms, I think you can access free all the
Mm,
virtual cases, but
very
COVID
good.
related cases. Okay, this is another Lectorio. Um, you can access all the interactive case files related to COVID, but all
Mm.
these cases you can use even for normal flu also. Okay, what is the legal responsibility? I think, Dr. Ali, you can go to my YouTube. I have given a workshop on ethical use or responsible use of AI in medical education. If you ask me, again, it depends
Is it
on how
possible to have it again for us, for
can
Iran?
can can I can. You can just let me know, arrange the session, and I will do it again. I have conducted a workshop also on ethical use of, and I shared some tools,
Okay.
and even
Oh,
even
this is a
now,
very important thing for us. The
yes,
um, legal
no
responsibility,
worries.
the auditors,
Yeah,
and then the other things that is related to the use of AI in the, let's say, light of legal issues is very important for us. And then if
yeah,
it's possible for you to have as soon as possible the
sure, sure.
webinar in this regard as soon as possible, if it's possible for
Yeah,
you.
maybe by next
Sure.
week we can do. No worries.
Thank you, thank you.
No
We will
worries.
try to arrange it
Yeah,
and then announce throughout the
perfect.
country to have this good webinar.
Sure.
AR, legal responsible AI. Thank you.
Yes. Yeah.
Thank you. Is there any question? I think nothing.
Okay. What is that mean? Sapa Salah Garazam
So that
Ustad.
means thank you very much.
Oh,
Ustad,
okay. Okay.
and thank you, Professor. Thank
Good,
you,
good.
Professor. Thank you.
I also enjoyed this session, and thanks once again for
Thank you.
Smart University of Medical Sciences and our host for the Zoom sessions also. Thank you
Thank
for
you.
arranging. And all the best. Please explore these tools
Thank
I
you.
shared and see you in our next session, right?
Thank you very much.
Thanks. Thanks.
Finished.
Stay
Thank you very
safe.
much,
All the
Dr.
best.
Hasnain.
Yeah.
As the let's say previous sessions that we had, it is with you. This session is also very fruitful, and we learn me myself. Let's say we learn many things new, and then it is the begin. Let's say starting point for next webinar about the let's say legal issues of the use of AI. But I
Sure.
ask you to let's say develop it. More than medical education, is it possible for you to have something new for us because your
Sure.
career and
Yeah.
your, let's say, research in this regard tell us many things, and it would be very good for
Yeah.
the development of knowledge and the attitude of our professors and our learners in Iran and via the region, because we use the EcoSF platform with the tank of them in
Yeah.
the region, and it could be very fruitful for us. Thank you very much again, and then inshallah you are in safe, and you will be safe, and then we have you next webinar as soon as possible if inshallah will be arranged. And I like to thank again from the Professor Tayyibi, the EcoSF president, and engineer Khalid Reza that have helped us many times. And again, please have my apologies for the inconvenience that with the starting point of this webinar, we have a change in time. And then thank you again, and please be with us in next webinars, inshallah, and then have good feedbacks from the participants, the audiences, the dear good
Thank you.
audiences, the professors of medical universities throughout Iran have participated in this webinar, and then I'm asking them to, let's say, give us the feedback for improving and let's say improving the quality of these webinars, and have new, they can say us about new titles and the, let's say, the things that we can have here with the feedback that they give us in this regard. Thank you very much again, and
Sure.
inshallah, may Allah bless all of us, and then
Thank you.
have you in next seminar.
Okay. Bye.
Bye-bye. Thank you very much.